Hi everyone, Dr. Femi Ayodele is my name. Today I want to discuss very important topic, which is chest pain. Chest pain is a common presentation in general practice. However, the diagnosis of chest pain is sometimes very challenging, as there are some life-threatening conditions that present with chest pain, and these life-threatening conditions must not be missed. For this reason, I will advise you, whenever you have chest pain, ensure you visit a doctor so that the cause of the chest pain can be established, the right diagnosis is established, and appropriate treatment is commenced. Having said this, I will quickly enumerate the causes of life-threatening condition that present with chest pain before I go to the simple causes of chest pain. The life-threatening conditions, the first one on my list is what we call acute myocardial infarction. Acute myocardial infarction is commonly called heart attack. This usually presents with chest pain. Sometimes it may be a classical symptoms of heart attack, which is like stabbing or crushing central chest pain. There may be shortness of breath, the patient may become dizzy, the patient may be having nausea. In such situation, we take it as an emergency situation. Immediately we have to commence resuscitation, and also take brief history, examine the patient, and commence treatment. Usually, the treatment we usually give is to ensure that the patient, the pain is reduced by giving pain reliever. We give aspirin, we give what we call nitrates, and sometimes when the patient requires oxygen, we give oxygen to the patient. Then we refer to the patient to the hospital, where a cardiologist will continue the management, the further management. However, when the patient is discharged, we must continue the follow-up because the treatment has to be ongoing. We have to do what we call heart attack action plan for this patient, because if this patient has another episode of pain, the patient must have the medication to take, must know how to take the medication, and also must know when to present to the hospital. Also, we have to put this patient in what we call cardiac rehabilitation, which will involve a lifestyle modification of this patient. It involves exercise, it involves diet, and other to stop smoking, to reduce alcohol intake if the patient is taking excess alcohol. Other life-threatening condition I want to talk about is pulmonary embolism. In pulmonary embolism, the patient will present with chest pain. Sometimes the patient will be having breathlessness. Sometimes the patient will be coughing, and sometimes there will be blood in the cough. Usually this is caused by dislodgement of clot of blood from the lower limbs, from the legs, from the calf muscle, from the thigh or the pelvis into the lungs, now blocking the air passage in the lung. Usually there are conditions that usually cause these clots in the lower limb, which include when the patient is immobilized for some times, maybe a long distance lorry driver, or patient has been on flight for hours and was sitting down, not moving around, or patient who had recent surgery, or patient who has had episode of clots in the before. So such patients have risk factor for developing clot and dislodging to the lung. This condition is also life-threatening. The patient has to immediately be sent to an emergency department where further treatment would be done. I would want to talk about tension pneumothorax. Is a very important cause of chest pain that must not be missed. Most of the time, the patient may have pre-existing lung condition, or there may be trauma, injury to the chest wall, or maybe the patient has primary tension pneumothorax where there is no known injury, there is no known underlying lung disease. In this case, the patient will present with shortness of breath. Usually it may be one-sided. When we examine the patient, we'll discover that maybe the trachea is becoming deviated. There may be increased resonance when we percuss the chest wall, and the breath sound usually reduced. So in this condition, it is an emergency condition, emergency surgical condition, where a surgical intervention must be commenced immediately. Other life-threatening condition is aortic dissection. Having said this, there are some simple conditions that may cause chest pain that does not relate with the heart. Such conditions include muscle strain. The chest wall, there may be muscle strain that is causing chest pain, which is just a simple condition that can be easily treated. Also, sometimes there is what we call costochondritis, which is the ribs, pain coming from the ribs. Sometimes what we call heartburn may be present with chest pain, with patients having what we call gastroesophageal reflux disease. Ulcer also, patients with peptic ulcer disease may present with chest pain. Pancreatitis is a common cause of chest pain also. Other respiratory diseases like asthma, pneumonia, they are common cause of chest pain. Also, panic attack may present with chest pain. So for this reason, whenever you have chest pain, I will advise you that you should always present to the hospital. Let doctor examine you so that the cause of the chest pain can be established, appropriate diagnosis can be established, and appropriate treatment and follow-up can be established. I hope you have learned something from this short video. Thank you so much for listening. Peace out.